In this video, we'll talk about physical development in middle adulthood. Specifically, we'll be looking at the difference between primary and secondary aging, the changes that occur with our senses, health concerns, the climacteric and how that impacts sexuality. We'll also talk about the importance of sleep, exercise, and nutrition, as well as brain functioning and the impact of COVID-19 on health and brain function. So starting off, the difference between primary and secondary aging. Primary aging referring to aging due to biological factors, such as molecular and cellular changes, oxidative damage, things like that, as the contributors to aging that we don't have control over. Secondary aging, on the other hand, aging that occurs due to controllable factors. So things like your lifestyle choices. So whether or not you're engaging in physical exercise, what your diet is like, whether you smoke, things like that. So that's kind of the main differences there. So let's talk about some of our physical changes. And again, for middle adulthood, generally considered 40 to 60, 65. So we see a lot of those continued changes that started near the end of established adulthood in your 30s, like the hair changes, so hair becoming more gray and thinning. And genes largely influence these changes. Some definitely start to gray or go bald in their 30s, others later or earlier. It definitely depends. In terms of skin, the skin will dry, thin, and loses its underlying fat layer. And so wrinkles become more common. This is influenced by genetics, sun exposure, and smoking for wrinkles. So it's a little bit of both primary and secondary aging. Dark spots and blotchiness can also occur due to a combination of genes and sun exposure. Sarcopenia, this is the loss of muscle mass and strength that occurs with aging, and it is a significant factor in frailty and functional impairment. Exercise can slow it down, but it can't completely stop it. Our lung ability to provide oxygen and to remove carbon dioxide declines, and this can lead to shortness of breath. Minimal effects will occur for those who are physically active non-smokers, but it does become much more noticeable for people with chronic bronchitis, frequent pneumonia, asthma, or among people who smoke. Our senses change as well. Presbyopia literally means old vision or old eyes. Presbyopia refers to a loss of elasticity in the lens of the eye that makes it harder for the eye to focus on objects that are close to a person. And we mentioned this in established adulthood as well. So needing to get like reading glasses so you can see things that are close, as that lens becomes less flexible, and the muscles attached to the lens becoming weaker. Floaters also become more common. Those little, they're just little bits of protein that float across the eye. They're more annoying than anything real problematic, but those do become more common. We also experience photopic sensitivity. Essentially, our ability to see in dimmer light declines with age. By the age of 60, the retina is only getting 1/3 the amount of light that it received at age 20. So only, yeah, that's a huge difference, right? Only 1/3 of the light entering the pupil and reaching the retina at the back of the eye, that yellowy part in the diagram there. And that is where your photoreceptor cells are, is your retina. Hearing impairments also become more common with age. So before the age of 40, about 5.5% of people have hearing problems. Um, Between the ages of 40 and 69 years of age, 19% of individuals have hearing problems. And that's further broken down in the table, the graph on the slide there for incidence of hearing impairment in United Kingdom adults. Men are more likely to experience hearing loss because they are more typically in occupations where they're exposed to high levels of noise. So things like manufacturing, agriculture, the military, the construction, various occupational fields where you are exposed to more noise. Our ability to hear higher frequencies is the first to decline. So next we'll talk about some of the common health concerns in middle adulthood. First off, heart disease. It is the leading cause of death in the world, accounting for about 23% of deaths in the United States in 2017. And heart disease, kind of an umbrella term that refers to heart defects, rhythm problems, and blood vessel issues. The most common cause of heart disease or cardiovascular disease is atherosclerosis. And atherosclerosis is when there's a buildup of fatty plaques in the arteries that encircle the heart. And I mean, what they should be doing is providing oxygen and nutrients, but those plaques get in the way, and so less blood carrying less oxygen and nutrients are getting to the heart. And that's shown on the slide with that diagram of the artery wall without a plaque and then with a plaque. Cardiovascular disease can cause heart attack, chest pain, or stroke. Males tend to experience chest pain, while females are more likely to have shortness of breath, nausea, and extreme fatigue. Pain in the arms, legs, neck, jaw, abdomen, or back can also occur. Besides medical conditions like high blood pressure, high cholesterol, diabetes, and obesity, other risk factors include advanced age, your sex, your family history, smoking, poor diet, excessive alcohol use, excessive stress, and poor hygiene, which tends to be surprising for a lot of people, but yeah, poor hygiene. So things like not flossing, that increases your risk of viral and bacterial infections, which cause inflammation, and inflammation increases your risk of heart disease. So heart disease can cause heart failure, heart attack. Treatments include things like coronary bypass surgery, medications, pacemakers, angioplasty, and lifestyle changes. Hypertension, also known as high blood pressure, is when the blood flows with greater force than normal, and that strains the heart and increases your risk of heart attack, stroke, kidney damage, and even damage to your white matter. Remember, white matter referring to the fatty tissue in the brain. It often is coating our axons and helping to feed the sending of messages neuron to neuron. So blood pressure should be under 120/80. Systolic blood pressure is the pressure in the blood vessels when the heart contracts or when it beats. And then diastolic pressure, the bottom number, the pressure in the blood vessels when the heart is relaxed. Hypertension is sometimes called the silent killer, as most people don't experience any symptoms. You don't know your blood pressure is high until you have a heart attack or something. There are several risk factors for hypertension: family history, a diet too high in sodium and too low in potassium, sedentary lifestyle, obesity, excessive alcohol consumption, and tobacco use. Next, cancer. Cancer is the second leading cause of death just a few percentage points behind heart disease. Cancer is a collection of related diseases in which the body's cells begin to divide without stopping and spread into the surrounding tissues. These growths or tumors crowd out our healthy tissues and organs. Cancer can metastasize or travel from its original site, often referred to as the primary cancer, by way of the lymph system or the blood vessels to other parts of the body and start new tumors. There are more than 100 types of cancer. The most common breast cancer, lung cancer, and prostate cancer. Lung cancer, however, is by far the most deadly. A complex interaction of genetics, biological aging, and environmental factors contribute to cancer. So yes, there are genes that put you more at risk. It also becomes more likely as you age that your cells suffer this malfunction, and then environmental factors like smoking, unhealthy eating, things like that increase risk of cancer. The best ways to reduce death from cancer are having an annual medical checkup and knowing the 7 warning signs. So the 7 warning signs for cancer: a change in bowel or bladder habits, having a sore that doesn't heal, experiencing unusual bleeding or discharge, a thickening or lump in the breast or elsewhere, indigestion or difficulty swallowing, an obvious change in a wart or mole, and then having a nagging cough or hoarseness. And these are pretty general, but because cancer can affect so many different parts of the body, they are going to be more general warning signs. So again, annual medical checkups and doing those self-screenings. So checking for doing a self-breast exam, doing a self-testicular exam are another great way to help catch cancer early. Cholesterol. So cholesterol is a waxy fatty substance that is carried throughout the bloodstream. It is necessary for digesting our food and helping to create hormones. However, too much is bad, leading to heart disease and stroke. Particularly low density lipoprotein or LDL cholesterol, often referred to as bad cholesterol, as it can clog your arteries. Excuse me. Risk factors include having a family history of high cholesterol, having diabetes, eating a diet high in saturated fats, trans fats, and cholesterol, sedentary lifestyle, and obesity. We also have diabetes, which is when the body doesn't control the amount of glucose in the blood. And that occurs when the body doesn't make enough insulin or is not using insulin properly. Type 2 diabetes is the most common type for adults and typically begins with insulin resistance. So the cells in your muscles, liver, and fat stop using insulin properly, and you need more and more insulin to control your blood sugar. Eventually, the pancreas loses the ability to produce enough insulin, and it becomes more problematic. 1 in 3 adults have pre-diabetes, but 9 in 10 do not know they have it. Men are slightly more likely to develop diabetes than women. However, this obscures race and ethnic differences. American Indians and Alaskan Natives have the highest rate of diabetes, followed by Black Americans, Hispanics, Asian Americans, and finally white Americans. Risk factors include being over 45, obesity, family history, if you have a history of gestational diabetes, your race or ethnicity, an inactive lifestyle, and diet. Diabetes linked to many of the health problems that we've talked about: heart disease, heart attack, stroke, also linked to blindness, kidney failure, amputation, and more. Metabolic syndrome is a cluster of cardiometabolic risk factors, including having a large waist circumference, high blood pressure, and elevated triglycerides, LDL, and blood glucose levels that can lead to diabetes and heart disease. We also see an increased incidence of rheumatoid arthritis. This is an inflammatory disease that causes pain, swelling, stiffness, and loss of joint function. And it is an autoimmune disease. So it occurs when your immune system attacks the membranes lining the joints, as opposed to osteoarthritis, which we'll talk about in the next chapter, which occurs in joints that are commonly used. With rheumatoid arthritis, because it's an autoimmune disease, it tends to occur throughout the body, not just in high use joints. It also tends to occur mirroring the body, so occurring in both sides of the body. Again, because it's the immune system attacking the joint linings, as opposed to due to overuse and damage in the joints. Fatty liver disease refers to the accumulation of fat in the liver. Previously, the main cause of fatty liver disease was excessive alcohol use, leading to cirrhosis. Today, the main causes are eating too many calories and physical inactivity. And there are more things. I won't go over every little thing. Yeah, read the chapter. Sleep. Sleep, still important throughout our life. The American Academy of Sleep Medicine recommends adults get 7 to 9 hours of sleep per night. Only 59% of Americans meet this recommendation. About 9% of Americans have been diagnosed with a sleep disorder, most commonly sleep apnea, accounting for 71% of sleep disorders among adults. Followed by insomnia, accounting for another 24% of those sleep disorders among adults. Individuals with chronic or acute pain also tend to get less sleep. Stress and overall poor health worsen sleep quality and tends to shorten its duration. Menopause can also impact sleep, as can having children living in the home. So having children in the home decreases the amount of sleep compared to not having children, with single parents having the highest percent of individuals not reaching that minimum of 7 hours. Sleep deprivation suppresses the immune system, increases risk of obesity, memory impairment, hypertension, colon cancer, breast cancer, heart disease, and type 2 diabetes. It increases your cortisol levels, which increase your blood pressure. So yeah, linked to a lot of poor health outcomes. Typically, if you're getting good sleep, that is associated with longevity. Less than half of midlife adults exercise, and only about 20% exercise frequently and strenuously enough to get health benefits. Exercise increases muscle mass, bone density, and metabolism. So it helps to also control blood sugar and to relieve stress. The best exercise programs are regular. They should include cardiovascular activity, aerobic activity, so things like walking, jogging, swimming, cycling, what have you. It should include weightlifting and stretching, and even some activity leads to benefits. So you don't have to run a marathon or anything. Brisk walking will give you benefits. For substantial health benefits, adults should exercise at least 150 minutes per week at a moderate intensity, or at least 75 minutes of vigorous intensity aerobic activity. And you can split this up and spread it out throughout the week. You should engage in at least 10 minutes at a time, though. If you're looking for more extensive health benefits, 300 minutes per week of moderate intensity aerobic activity, or 150 minutes per week of vigorous aerobic activity. Again, you should also include moderate to high intensity muscle strengthening activities that involve all the major muscle groups 2 or more days per week. Nutrition. As we get older, we need fewer calories. However, it's important to still eat right to avoid vitamin and mineral deficiencies. It is especially important to avoid excess sodium, fat, and added sugar, not only due to increased weight gain, but because they are linked to several health problems. Uh, weight, weight gain is very common in middle adulthood, especially as fat accumulates in the abdomen. This is often referred to as the middle-age spread. Men typically gain more fat on their upper abdomen and their back, while women typically gain fat on their waist and upper arms. Even if one's diet hasn't changed, this weight gain occurs due to a slowing of the metabolism. So our metabolism is the process by which our bodies convert food and drink into energy. To maintain one's earlier physique, midlife adults have to increase their exercise, eat fewer calories, and watch their nutrition more closely. Obesity rates continue to increase, and 42.8% of those 40 to 59 years of age are obese in America, the highest percentage per age group. Not only does obesity put one at risk of health problems like diabetes and heart disease, but it's also been linked to being more likely to develop Alzheimer's disease, and a higher body mass index was associated with getting Alzheimer's sooner. Even in obese individuals without Alzheimer's disease, more brain changes that are typical of Alzheimer's disease were seen. Those neurofibrillary tangles and the plaques. Researchers believe that fat cells may produce harmful chemicals that inflame the blood vessels, including those found in the brain, leading to this increased risk. Obesity also a significant risk factor for severe COVID. It triples the chances of hospitalization due to obesity reducing immune function and decreasing lung capacity and lung reserve. Countries with the highest obesity rates also have the highest rates of hospitalization and death. In conclusion, lifestyle has a strong impact on midlife adults' health, and there are several ways that we can boost our likelihood of being in good health and improving our well-being. So let's talk about the climacteric. So the climacteric is the midlife transition where fertility declines, and in women, it stops. So yes, men go through a climacteric as well, and we'll talk about that next. But first, the female climacteric. Perimenopause refers to a period of transition in which a woman's ovaries stop releasing eggs and the level of estrogen and progesterone production decline. Menopause is defined as 12 months without menstruation. The average age of menopause is 51. However, women can begin to experience symptoms in their 40s as perimenopause begins. Symptoms of perimenopause and menopause are usually caused by hormonal changes, and this can lead to changes in sleep, hot flashes, which are surges in adrenaline that awaken the brain and produce sweat. The loss of estrogen also diminishes vaginal lubrication, which combined with thinner vaginal walls and less elasticity can lead to pain during intercourse for some. Decreases in estrogen also lead to decreased bone mass and can lead to osteoporosis. Depression, irritability, and weight gain are associated with menopause, but are not necessarily menopausal. Depression and mood swings are more common during menopause in women with a history of these conditions prior to menopause. So women greatly vary in the extent to which they experience menopause symptoms, with most going through menopause with few problems. Hormone replacement therapy was previously commonly prescribed for menopausal women, but more recent research showed how it was associated with greater risk of breast cancer, stroke, and blood clots. So now most women who don't have severe symptoms are not prescribed hormone replacement therapy. When it is prescribed, Typically, it's low doses of estrogen being used, and women are monitored more frequently for negative side effects. Menopause symptoms vary greatly across countries and ethnic groups. The study of women's health across the nation examined almost 15,000 women of various ethnicities. It found that white women were more likely to share symptoms of depression, irritability, forgetfulness, and headaches. African American women reporting more night sweats, and Chinese and Japanese American women reporting the fewest symptoms. So generally, white women reporting more mental health symptoms, and Black women reporting more physical symptoms. Culture also influences how menopause is experienced. Hmong and Mayan women both reported that there isn't a word for hot flashes in their languages, and both groups don't experience menopause symptoms. While some see menopause as a sign of aging and a loss of attractiveness, many women think of it as a liberating time. For example, Japanese women tend to see it as a transition from motherhood to a more whole person without having those obligations of parenting. In India, 94% of women said that they welcomed menopause, likely because they gain status and prestige, and they no longer have to go through self-imposed menstrual restrictions. The wide variation in physical symptoms and attitudes toward menopause indicates it's not just a hormonal event, but is also affected by cultural beliefs and practices. Men also experience a climacteric. Although sperm production continues through life, men do have a decrease in both sperm volume and motility starting in their 20s, and a decline in semen after the age of 40. Males also experience a gradual decline in testosterone through middle adulthood. Erectile dysfunction, the inability or inconsistent ability to achieve an erection, does become more common in midlife. Intermittent erectile dysfunction affects as many as half of men between the ages of 40 to 70. Chronic erectile dysfunction affects about 4% of men in their 40s, 17% in their 60s, and about 47% of men who are over 75. So it definitely becomes more common with age. 70% of chronic erectile dysfunction cases are due to medical conditions like diabetes, kidney disease, alcoholism, and atherosclerosis, which impact blood flow to the penis. Psychological factors like stress, depression, and anxiety account for 10 to 20% of chronic erectile dysfunction cases. Many midlife males experience prostate enlargement with age, and that makes it difficult to start urinating, to completely empty the bladder, and frequent trips to the restroom, which disrupt sleep and daily life, become more common. Testosterone levels gradually decline, but this is not typically problematic for most. However, andropause, or late onset hypogonadism, refers to having a significant decline in testosterone levels. Low testosterone is a problem if negative symptoms like fatigue, low sex drive, erectile dysfunction, muscle or body hair loss, or breast enlargement occur. Long-term testosterone replacement therapy can increase risk of prostate cancer, blood clots, heart attack, and stroke. So like hormone replacement therapy to address menopause, it's something that must be weighed carefully with a doctor, because there are risks. So the climacteric and its impact on sexuality. Most midlife adults report that sex remains important to them, with 74% of men and 70% of women 40 to 49 reporting engaging in intercourse in the past year. The percentage dropped somewhat for those 50 to 59 years of age, so dropping to 58% of men and 51% of women. The age-related physical changes the climacteric brings is thought to account for this drop in frequency. Arousal tends to be slower and more stimulation is typically required. Women may experience decreased sexual desire due to less vaginal lubrication, due to menopause, and things like less vaginal lubrication is common and can lead to pain during intercourse. Men may need more stimulation to achieve and to maintain an erection, as they may be experiencing erectile dysfunction or have medical conditions like diabetes or heart disease, which can impact sexual functioning. Contraceptives are still important to use to avoid pregnancy until a woman has been without menstruation for at least 12 months, sorry. So has officially hit menopause, full year without menstruation. Safe sex practices are still important for avoiding sexually transmitted infections. Adults over 40 have the lowest rates of condom usage, and in 2014, 16.7% of US new HIV diagnoses were among people 50 and older. Increasing education efforts may help to decrease this number. Many middle-aged adults maintain most of their cognitive abilities and some areas of improved cognitive functioning. The brain is still plastic and is still able to learn and rewire itself. Older adults also use more of their brains than younger adults, and bilateralization, or the use of both hemispheres of the brain, is more likely in those who maintain a high level of cognitive function. The amount of white matter in the brain increases into one's 50s before it begins to decline. And again, remember that white matter referring to fatty tissues, such as the myelin sheath that encases axons. Gray matter, if you remember, referring to the cell bodies or the somas of those neurons. Midlife adults also tend to be calmer, less neurotic, and better at managing their emotions in social situations compared to younger adults. And that's due to focusing more on positive information and changes in the amygdala, leading to them becoming less responsive to negative stimuli. Many midlife adults peak in their financial decisions in their 50s, but we do see great amounts of cognitive variability in middle adulthood. So COVID-19 does appear to directly affect the central nervous system referring to the brain and spinal cord. And this is based on the increased risk of being diagnosed with a psychological disorder following COVID infection. The risk was greatest for anxiety, insomnia, and dementia. The study also found that people with a mental health disorder had a 65% higher risk of getting COVID-19. So higher risk of COVID-19 causing a mental health disorder, and then those with a mental health disorder having a higher risk of catching COVID. Another study found that loss of taste and smell were associated with a greater risk of anxiety and depression, but not for other COVID symptoms. And this suggests that the virus enters the central nervous system through olfactory neurons, or neurons that are responsible for smell. Almost 34% of COVID survivors are diagnosed with a neurological or mental health condition within 6 months of infection. So that's 1 in 3. Post-COVID psychosis is rare, but it is being further researched as it may have a link to COVID. And that wraps up our physical development section. Thank you.